I'm Amanda Missey. I am the CEO of Bergen Volunteer Medical Initiative. As Paul said, I think we're known to most of you. If we're not, we are a healthcare center that provides free primary health care to low-income working Bergen County residents who don't have insurance. And I don't know about you guys, but pretty much every morning now I get up and look at my phone to see what new disaster has befallen the world or the country. And the stuff that's going, the fires are horrible, the storms are horrible. I mean, it's all just kind of like you can't even take it in. And I guess the thing I want to remind you, and I'm kind of preaching to the choir, is that there are still a lot of needs right here at home that I hope that you will continue to support. So we moved into a brand new facility in March. It seems like yesterday, but it also seems like 10 years ago. We have it's an amazing new facility. I invite you all to come. Actually, the whole club could come. I'll feed you lunch if you come visit. I can't do breakfast. No, I can do breakfast. We can do breakfast. Anyway, we moved into a 5,000 square foot healthcare center. We went from 3,500 square feet to 5,000 square feet. So that's a big leap in terms of room, and we really needed it. So we have 6 exam rooms. We've got 3 consult rooms now, so we can do eligibility screening in private. We have a place for our nurse navigator to work with her patients. We have a dedicated diabetes education room. We have a beautiful, expansive nurses station that gives all of our volunteers and staff people room to work. In our old place, we were literally on top of each other. So we had volunteers working in our break room, so we'd have maybe 6 people sitting at this little table eating lunch, and we'd have people in 3 different corners sitting at their computers or on the phone trying to work. So we had 9 people crammed into a tiny little room. So we have a lot more space. We've got administrative space for our volunteers to work. We have our own boardroom now. Our board finally had their first ever board meeting in our own facility for the first time in 8 years, so that was really nice. So anyway, it's a beautiful new facility. Now what's happened is we have had a 17% increase in patients since we moved in. So we are really busy, which is great. So one thing, I'm going to ask you for a couple things. The first thing I'm going to ask you for is if you know any doctors or nurse practitioners who are either retired, semi-retired, or even working and might have some time to give us. We are not quite in desperate need yet, but we really, really, really need practitioners. So I said we've had a big increase in patients. So what's happening is it takes about 4 weeks for them to get an appointment to come in for eligibility screening, and it's taking another 4 weeks to get them a doctor's appointment, and that's too long. If people need health care, they need it right away. So if you know of anybody who might want to come and volunteer for us, please, I'll give you my card. There's information on the table there. Send them our way because we could use them. What else can I tell you? So we have right around 1,100 patients. About 40% of those patients are either diabetic or pre-diabetic. So if you know anybody with diabetes, you know it's a really it's a chronic disease, so first of all, people have to learn how to live with it ongoing and how to manage it. But it really can be debilitating. It can kill people. It can take their limbs. It can take their sight. So we work really hard with our diabetic patients. There's about 100 of them. We work with them. They come to see us about once a month, and so. Most of you, if you go to your doctor, maybe you go with a list of questions that you want to ask them. Maybe you take somebody with you so you have a second person hearing what's going on. Most of our patients, many of them don't speak English as a first language, and most of them have very low health literacy. So if they come in and we say, oh, you've got diabetes, first of all, they have no idea what that means. We've had people say, I'm not taking insulin because my brother took insulin in Mexico and he died. So there's a lot of misconceptions about the disease and how to manage it. So we work really, really hard with these patients to help them understand what it means to have diabetes, what it means to not manage that diabetes if they have it, and then we help them understand how to take their medication, how to eat right, you know, how to get out and move around, and how to, I guess, accept it as something that they're going to have to live with for the rest of their lives and really try to manage it on their own, or with our help. So we have 100 diabetic patients. We have 350 patients who have prediabetes. So that means that their numbers are really close to sending them into the diabetic range. So we want to keep that from happening. So again, we work with them on nutrition. Some of them are put on medication to keep them from going up into the diabetic range. We talk to them about exercise and things they can do with their lifestyle to help not go into the diabetic range. We have a lot of people who we have a lot of immigrants. And one of the things they do is when they come to this country, they want to be just like the Americans are. So what do? They start drinking soda. They start eating fast food, which we all know is not good. So we help to, we're culturally sensitive, so we try and teach them how to eat correctly in this country. So we help them. We have fake food. Doesn't look very appetizing, but it gives people an idea of what a serving size is. But we have mashed potatoes, but we've also got rice and beans. So we really work with patients to help them understand what's going on. One of the really exciting things that we have just launched is our new obesity program. Half of our patients have a BMI of 25 or over. So 25 is overweight and 30 is obese. So we have 30 patients who are in this obesity program. We've got one session for English speaking and one session for Spanish speaking. They're going to meet every 2 weeks. And then we've got 4 teams of volunteers who are going to work with them on nutrition, on exercise, on stress relief, and on behavior change. So this is a really intensive program. How many people here have ever been to Weight Watchers? Okay, so Weight Watchers, you know, you go every week and you talk about...
How many people should go?
I didn't ask that. Okay.
I wasn't looking at you, Tom.
I don't know you guys well enough to
I
ask
want to
that.
know who went. Everybody looked over here at me.
Anyway, this is a really intensive program. It also, so I talked to the doctor who's heading it up, and they've had an orientation meeting in both Spanish and English at this point. And he said that by the end of the meeting, they were like kind of joking with each other and giving each other hugs and talking about what's going on in their lives. So I have it's hard to get our patients in on a regular basis because they're maybe working 3 jobs, they've got childcare issues, they've got transportation issues, they're trying to manage families and live in poverty at the same time. So I had my doubts about whether this was going to work, but I think that based on what he said, if they keep coming to us and they keep getting what they need, they're getting not only the education, but the camaraderie and the feeling that they're not in it alone. I think that it's going to work. So the next time I come and talk to you, I'll tell you how it's going. What else? We've got a women's health initiative. 65% of our patients, so 650, 675, are women. And most of these women are the primary breadwinners in their households. They have young children, and they also have aging parents in homes. So they've got a lot on their shoulders, and they put their needs at the very bottom of the list. So if they get sick, the whole family goes down. So what we do is we make sure that they're healthy by giving them a primary care visit. We also do an annual well woman visit. And then provide whatever they need for that stage of life. So it might be help with family planning. It might be a mammogram. Every woman who is 40 or older who hasn't had a mammogram in the last year, we refer out for a mammogram and make sure she gets it. So we want to keep these women healthy so they can keep their families healthy. What else do we do? I want to tell you about a patient. So there's a guy named Miguel. He's probably 30 years old, I guess, and he came here from Venezuela. Now, you guys know that's another place that's kind of going crazy right now. Miguel came to us. He's got a lovely wife and a little boy who's about 2. And he came to us, and his numbers were off the charts. I don't know what his A1C was. It was like 13 or 14, and it's supposed to be down in the 5s. So he came to us, raging diabetes. We put him on insulin. What he's done now is he's applied for medical asylum to stay here and not have to go back to Venezuela because he can't get his medication in Venezuela. So we're helping him stay healthy while he's here. We actually wrote a letter saying that medically he needs to be in a place where he can get insulin or he's going to die. But he's working, he's caring for his family, and we're helping him stay healthy so that can happen. So we are going to keep growing, and I think we can get to about 1,500 patients, so we've got another 400 to go. We are always looking for volunteers. We have about 125 volunteers right now. We've got 55 clinical volunteers, and then we've got another 70 or so that serve on committees that come in, and we've got a great volunteer who pulls data out of our electronic medical records. We have volunteers who make phone calls to people to remind them of appointments or to help them make sure they've got everything they need to come in when they come in for their eligibility interview. So in order to become a patient, somebody calls us, we do a little phone screening on the phone. If it sounds like they'll be eligible, we have them come in for an eligibility interview because we want to make sure that we're helping the people who most need it. So we ask them to bring proof of residency and also their income. And somebody in the household has to be working. It does not have to be the patient. So we have a lot of people who might have employer-sponsored health insurance, but the rest of the family doesn't have it. They can earn up to 300% of the federal poverty level. Anybody know what 100% of the federal poverty level is for one person? 16, 18, it's right around 12. So it's not very much money. So up to 300% of the federal poverty level. So we spend about an hour with them, interviewing them to make sure that they are appropriate for us financially. Then we'll do a medical history to make sure that they're medically appropriate. We can't have people walking in that need a knee replacement or a hip replacement. Even though we could get that for them, we're really a primary care facility. So that we want to make sure that they're medically appropriate for us. The next thing that happens is we have them get their blood drawn. We do lab work. Quest Diagnostics actually provides all of our lab work for free, which is a tremendous donation on their part. Really, what would happen, it wouldn't be us paying for the lab work, it would be the patients paying for the lab work, so that takes a lot off of the patients. And then we schedule them to see a primary care physician who will become their doctor. So every time they come to see us, they will see that same doctor. Kind of like when you go to your doctor, you see the same doctor usually. And then whatever happens at that appointment, they might have to come back for a well woman visit. They might come back to see our diabetes specialist. We might refer them out for some kind of a diagnostic test like a MRI or a mammogram or a colonoscopy. And then they become our patient. And if they're sick, they can call us and we'll get them in to see our nurse practitioner who does sick visits. We take care of them from that point on. We don't take care of children, only adults, because children have the Children's Health Insurance Program, at least right now. So basically it's Medicaid for kids, so they get care. So I said I was going to ask for a couple things. So volunteers, clinical volunteers and regular volunteers, we're always looking for people who speak Spanish. We have 65% of our patients are native Spanish speakers. We're starting to do big outreach towards the Korean community. Did you know that the second largest Korean community is here in Bergen County in the whole country? So, and a lot of them are recent immigrants. So you do not qualify for Medicaid or Medicare if you haven't been in the country legally for 5 years. So even if you have a green card, if you haven't been here for 5 years, you cannot get Medicaid or Medicare. So an immigrant population immigrant populations are really kind of up there for us in terms of our target market. You can tell people about us who might want our services. We have these recruiting cards. We have them in English, Spanish, Polish, Chinese, and Korean. So I've got English and Spanish here if you want to take some of these. Our patients are people that you interact with every day. They are people, servers at restaurants, the busboys at restaurants, the people that do your lawn, part-time bank tellers who don't have insurance through their company, so, people who work in nail salons, so people who work in, hourly jobs and don't make very much money. Those are our patients. So please tell people about us. I want to thank you for the contribution that you gave us at the end of your last Rotary year. We are clearly putting it to work. We're having to raise a lot more money this year because of this expansion. Our budget has bumped way up, and it's going to go up even more next year. Question.